Hello everyone, and welcome to this edition of the ASPS vlog. This week we are talking about breast implants. The reason we chose this topic is that whenever I meet patients in the office, whether it's for breast reconstruction or to discuss breast enhancement with implants, it's all very confusing. There are so many different types of breast implants by many different manufacturers. It's a little bit tricky to figure out where to go and what to choose. So today we're going to break this down into a few categories to try to simplify this for you. So let's focus our attention on these two implants here. When I guide my patients in the decision-making process with breast implants, this is the first thing we talk about: saline versus silicone. So the filling material in this case is saline water, and here we have silicone. One of the advantages of having an implant filled with saline is that if the implant ruptures, the body will reabsorb the saline water. This is obviously not the case with silicone. One of the downsides of the saline implant is what you can see here, which we call rippling. So these little ripples can be sometimes visible through the skin, and so this is one of the downsides of the saline implants. Thankfully, there is a new technology, or a fairly new technology, called fat grafting that can help address the rippling problem. So with fat grafting, what we do is we take fat from one body part where there may be too much, and we transfer the fat into another body part where we want to either change a contour or augment the volume. And so fat grafting can, for example, help address rippling if that's an issue. Another difference between the saline and the silicone implant is their cost. The saline implant tends to be cheaper than the silicone implant. So the next decision patients have to do when choosing breast implants has to do with projection. So you can see here that these two implants are quite different. This one is flatter, and we call this a lower profile, whereas this one here is a high profile implant. So these two different implants would be used in different scenarios. For example, if someone, let's say, has breast asymmetry, so a difference in size between the two breasts, it could be useful to have an implant with a lower profile on the larger breast, and then the smaller breast could be augmented with a high profile implant so that they meet in the middle. Another instance where these different implants could be chosen is really based on patient preference. Some people may want a breast that is more projected, which is how the breast sticks out of the body, whereas some people might want something a little bit more subdued. So the next choice I present to my patients has to do with the implant shape. So are they interested in having an anatomic shaped implant versus a round device? And also the surface of these implants, whether it's a textured surface versus a smooth surface here. So let's first talk about the shape. As you can see here, this is an anatomic shaped implant. Some people also refer to it as a teardrop shaped implant. And some women might find that an implant like this will give more of a natural result. An implant that is like this one, so a round implant, is round in this dimension over here. And if you look at it on the profile view, you will see that you will get a little bit more fullness in the upper pole of the breast when choosing a device like this. So again, it's based on personal preference. The other difference between these two implants is the surface membrane. So as I mentioned earlier, this is a textured implant and this one is a smooth implant. The texturing is actually essential when we are talking about anatomic or teardrop shaped implants, because the texturing is really what allows the implant to stay in position and minimize the risk of having a rotation of the implant within the breast, which could cause some serious aesthetic problems if the implant was to turn like this. As we can see with a round implant, if the surface is smooth and the implant turns within the breast, the shape will be preserved. So now this brings me to the last category of difference between implants, and this is size. As we know, size matters. So again, the surgeon can guide the patient in choosing a size based on what they've expressed in terms of personal preference, but it's important to know that there is a wide range of sizes, and so there's definitely something that will help you meet your goals. So now I would like to illustrate how the implant technology has changed over the years. And what I mean by this is the silicone breast implants. So what you see on this table here are two different generations of breast implants. So this one here is a newer generation of breast implants, and this one is an antique that I found in my office. And so I'll illustrate the differences between the two before we get into the cutting. But even before that, I think what is important to mention is that all breast implants, whether we talk about saline, whether we talk about silicone, they all have a surface membrane, so the outer shell is all made of silicone. So even if you choose to have a saline implant, the outer shell will be made of silicone, okay? So if we look at these two implants over here, so I mentioned that this one is a newer generation, and the reasons for this is that the silicone on the inside is more cohesive. So what does this mean? It means that the silicone is a little bit firmer, so the implant might actually feel a little bit firmer when it's implanted in the breast. But the advantage of this is that the silicone kind of stays together. And so if you look on blogs, for example, they will often refer to these implants as gummy bears, because when we cut them on the inside looks like a gummy bear. And the reason for these enhancements in silicone is that the older generations of silicone implants had more silicone that was a little bit more like honey on the inside. And so if you look at these two implants here, this one is also filled with more silicone, which helps maintain its shape. So if you look at this one here, you can see some rippling on the surface. This is for two reasons. One, the silicone on the inside is a little bit softer than this one, and the other one is that there is less percentage fill of silicone in this implant compared to this one. So I will now get into the cutting part. Okay, so bear with me. It might be a little sticky, but I will show you what's inside. So don't try this at home. It's definitely not advised. Okay, here we go. So again, this is a gummy bear implant. All right, so I think I can show you here. So this is the inside silicone, so the cohesive gummy bear silicone. And so if I squeeze the implant and a release, you can see that the silicone really gets back into its original shape. And so the hope is that there wouldn't be any spill of silicone like what we would see with the older generations of breast implants. Now that we have talked about almost everything regarding breast implants, and I've even cut an implant for you to show you what's inside, I think it's important to take a moment to talk about breast implant safety. The American Society of Plastic Surgeons has two breast implant registries that are worth mentioning. The first one is called the Profile Registry, and it focuses on all cases of BIA-ALCL, which is a rare type of lymphoma associated with breast implants. The second registry is called NBIR, for National Breast Implant Registry. This registry includes all women with breast implants so that we can track their data. I hope that you have found this video educational and maybe somewhat entertaining. I certainly had a lot of fun making this vlog. Thank you so much for watching. We'll see you next time.